Today is July 14th, 2016. Kay Wagner is talking with Dr. Larry Goodlund, a retired Gunderson Health System child and adolescent psychiatrist. Dr. Goodlund began practice with Gunderson in 1978 and retired in 2012, totaling 34 years of practice. Welcome. It's
Thank
good to
you.
see you again. I'm pleased to have you here. Do you have any corrections to the introduction?
No.
Okay. And then Jay Chautka is also with us behind the camera. So we'll start off a little bit with your growing up. You grew up in Minneapolis, it looks like. Tell us about your family history and background.
I was the eldest of two children. My father was trained as an engineer but appraised buildings, so that the building of the interstates through the city of Minneapolis paid for my medical school education. Both my parents worked, went to public school. It was a wonderful experience because we had kids from all social backgrounds, except that being Minneapolis, it was pretty much a one-color school. And then went to the University of Minnesota, hometown school, and was pre-med and majored in psychology. I probably know more about what a rat's going to do than what a person will do. Following that, went to medical school at the university, and then I did my internship at the university, at which point I finally broke all the way to the Male Graduate School of Medicine, 100 miles to the south of there, and spent 5 years living in Rochester.
What did your mother do?
My dad and my grandfather owned their own business, and my mother did much of the office work for it.
And your siblings?
My sister is 2 years younger than I am. She has worked as a union organizer for a medical clinic in the Twin Cities.
And then a brother?
No brothers, just
Okay.
the two of us.
I see. Anything else about growing up in Minneapolis? I imagine it's changed some since you were there, or since you grew up there.
Well, interestingly enough, the city of Minneapolis has gotten smaller by about 200,000 people, but the whole area has gotten much larger. And so that at the time I grew up, there were a lot of little neighborhoods, all had a name for the neighborhood, and were all kind of independent around a grade school. It was a very nice place to grow up. I can remember as a kid, at 8, 9 years old, we would, 3 or 4 of us would jump on the bus and go downtown Minneapolis to go to a movie, and our parents didn't think anything of it. I don't think that would happen today.
Probably not. We've described a little bit about your educational background and that you haven't strayed too far from your roots, but anything, or maybe you want to go into a little bit about the fellowships. You did a couple at least at Mayo.
Yeah, I've sort of been slowly working my way down the Mississippi River. I'm going to have to live a long time to make all the way to New Orleans, but well, I did my internship in pediatrics because I wasn't sure I was going to like being a psychiatrist, and I didn't want to be trapped. And then went down to the Mayo Clinic, and they kind of combined my fellowship and my residency together. And so I did most of I started out doing some child, then I did the general psychiatry residency, and then finished up in child again. And in many ways, the two clinics, Gunderson and Mayo, are very similar, except that at least at that time, the staff at Gunderson worked harder than the staff at Mayo. The residents probably worked the same at both places.
What made you think about coming to Gunderson then?
Actually, I was looking to stay in the Midwest, and one of the staff at Mayo suggested I come down here, a pediatrician that would come down to sail at Lake Onalaska. Suggested I come visit.
And what was your impression? Did it immediately attract you?
Well, it seemed a whole lot like what I was used to, only smaller, and I didn't have to wear a suit every day to work.
When did you first decide to become a physician? Was it something you thought about early on, or did you have a mentor or somebody that in your life that
I had thought about it. I used to watch doctor shows, and I thought, gee, Dr. Kildare has a really exciting life. So I was in high school, and I thought I was going to become a surgeon, not realizing you have to know your right from your left hand if you're going to be a surgeon. Then in high school, the concert took me out to Anoka State Hospital just outside of Minneapolis for a day. And I spent the time with a recreational therapist, and it was really interesting and exciting. And that's kind of what got me hooked on psychiatry. Interesting, the first time I really had an opportunity to go to a program for people that are thinking about being in medicine happened to be the day that Kennedy was killed, and the program was canceled. So that kind of is burned into my head.
the association?
Yeah.
Was there a particular mentor or role model? You mentioned physician that suggested you come down here, but somebody perhaps other than that in your life, parent or?
Well, nobody in my family had ever been in medicine. When I was just about to turn 16, so I was still 15, my aunt helped me get a job at Abbott Hospital in Minneapolis. I was the transportation orderly for a physical therapy department on Saturdays. And one of the things I learned doing that, one, I liked working in hospitals, and two, there was only really one really good job in a hospital, and that was being the doctor. In retrospect, I also realized, you probably don't want to put this on the tape, that being a hospital administrator is a pretty slick job too.
How so?
Well, when I was an intern, there was only one part of the hospital that was air conditioned, and that was the administrative wing.
How many clinicians were here? Do you remember when you joined the clinic?
I think somewhere around 150, give or take 20.
Did you have an assigned number? They did that in the early
I
years.
did, and I can't remember it, and I thought I would never forget it, but it was something, I think in the 130s or something, but I know they reused some of the numbers.
I think they did. I've heard that before too. Well, you were the first child and adolescent psychiatrist to join the medical staff here at Gunderson. How did the practice grow after your arrival, and how was it being the first?
Well, being the first, I was sort of lonely for a while because I'd been used to 3 or 4 other child psychiatrists I could ask things of, and so I would go to meetings just to kind of be able to talk to my own kind. But the practice was good. Another guy started the same day I did, Bill Nissen. He left after about 5 years, but it was hard work. It's always been hard work here, and but I liked the freedom that the clinic gave me.
I had a question that just went out of my head. What did Gunderson do prior to bringing on a psychiatrist in that field? Were patients then referred elsewhere for counseling?
Well, Dr. Listiak, Richard Listiak, was a psychologist that kind of specialized in kids. Otherwise, the kids were referred to outside of the area.
What's the biggest difference between child and adolescent psychiatry?
That's a pretty good question. First of all, you have to deal not only with the patient, but with the family and the parents, so that it becomes more complex because of that. And the diseases are developing, or the disorders are developing, rather than being as formed as they are in adulthood. In some ways, one of the things that's difficult is there are less resources for kids. And probably the high point of practicing child psychiatry as far as having resources was 12 to 15 years ago. A lot of the things that were resources available to us then have disappeared as far as being able to help kids out.
Can you elaborate on that?
The churches play lesser role in kids' lives. Things like the Boy and Girl Scouts play less of a role. The schools are struggling as far as having counselors and guidance people because of cutbacks, so that a lot of those community resources are gone. And I think this is true of medicine in a whole. Medicine becomes sort of the one institution that's still there, and as a result of that, gets overused sometimes.
Interesting. Were there other psychiatrists practicing at the time? I know you said that Dr. Listiak was a psychologist, but were there psychiatrists in other fields at Gunderson when you started?
Yeah, yes, there were. Well, the guy that came the same day was a general psychiatrist, and then there was Hans Anderson, Pauline Jackson, Josh Goldblum were all practicing here at the time.
Did they have their own specialty areas as well?
No, they pretty much covered the whole general field except for the child section.
You were also the first to use telemedicine, which must have been and is regarded as a huge technological improvement or achievement. How did that affect your practice?
Well, it was very interesting because at first I was a little worried about that, but there's a lot of patients that prefer telemedicine because they like the distance. And the group that seemed to like it the best were people on the autistic spectrum, because I guess they like talking to a TV set better than they like talking to a live person. But it really made things much easier. My primary place for using it was between here and Prairie du Chien. And so at the end, I would go one day a month to Prairie live and do one day a month on telemedicine. And since then, the department has kind of expanded telemedicine. It's it works out very well. You can with the high definition TV, you can pretty much read people's expressions. I learned that when my vice president was in Prairie du Chien, and she and I would have conversations while I was chair of the department, and I could really, without any difficulty, tell when she was upset.
And that wouldn't have been as visible in person?
Oh, it would have been as visible, but it gave me the clue that this was still real interaction.
Did you find that counseling via telemedicine was as effective as in person, as you were saying, just with the whole comfort?
Well, for some people it was more effective, and I think just about as effective. I don't know that I would want to have done initial assessments on telemedicine. So what I did was follow-up work. But
And what has taken the place of that currently? Is it still telemedicine, so to speak, or?
to be honest with you, I don't know.
And I don't either. Jay, do you know?
Yeah.
Is it pretty
It's
much
all
the same? Okay.
How many people are using it, Jake?
That I don't know.
In psychiatry?
I'm not involved with telemedicine much anymore.
Yeah.
That would be Amanda or Paul have those numbers.
Well, how's the field, your field, evolved over the years? And what is in your mind the greatest innovation?
Well, when I came here, they were not using very many medications for kids, and the use of medications has expanded greatly. The other thing that has expanded, at one point Gunderson had as many child and adolescent psychiatrists in one place as either the University of Minnesota or the University of Wisconsin did. So we had a pretty big section, and so we could do a lot of collaboration within the department. A lot of the things that have changed have been, many more therapists here than we had at the time. The psychiatrists are spending more time with people that have the more strictly medical illnesses, things like attention deficit disorder, autism, serious depression, those kind of disorders, and not doing very much psychotherapy or family therapy, which was things that we did more of when I first came.
Typically how many patients would be hospitalized, percentage or?
Well, at the time, the psychiatric unit, which kept changing how many people we would have, varied from about 25 to 32, and usually we would have about 3 adolescents over there. We would not admit anybody that was under the age of 12 because there wasn't a specialized area. Now, of course, there's a specialized area in the new hospital. I don't think they still take many actual children. It's very hard at least when I left, when you needed to hospitalize an adolescent to find a bed in the Midwest that was open.
Because they were full, they were occupied.
They were full. I would get, if on night on call, I would get calls from almost South Dakota.
Really?
Yeah. And we would get patients sent to us from Mayo or from Eau Claire, places like that. So there were at that time a real shortage of beds, and I don't think it's improved much.
If you feel comfortable sharing, is there a particular patient that you remember without using any names?
Well, I think, just being human, you like to work with some people better than others, and obviously they've done surveys, and psychiatrists do best with young, attractive, financially well-off, intelligent patients. And what a surprise, huh? And those are the people, unfortunately, I remember. I actually liked the fact that Gunderson took care of people that were in trouble in all fields, regardless to their financial background. And that, I think, was one of the strong parts of this clinic, and I think still exists that way, because one, it's the right thing to do, and two, it's often really challenging. I mean, I grew up very middle class, and suddenly I'm dealing with people that come from totally different backgrounds than I had. I mean, I grew up in Minneapolis. A lot of my patients here grew up on farms. A lot of people that I was taking care of grew up on community support programs or in foster homes, and this was not something I had much experience with and I learned a lot from.
Was depression one of the most common occurrences in terms of patients coming to see you, or?
Well, the most common one was attention deficit disorder, because it's a disorder that you treat with medicine a lot. Then probably short below that would have been depression, and I had sort of an interest in autistic spectrum disorders before it became a Hollywood phenomenon. And so I had a lot of patients that fell into that category. Plus, I was for a long time the only psychiatrist that consulted at Shalita, which is a treatment program for
Yes, I had that.
autism.
Is that still operating, or has it changed names?
I think it used to be the Shalita Habitation Institute, and it's now Shalita something else, but it's essentially the same. It's down by the south side, just off of Mormon Coulee Road.
Apart from your clinical practice, you served on both the Benefits and Ad Hoc Physician Compensation Committee. What were those experiences like?
Well, that was very interesting, because the compensation committee, every once in a while, all the medical staff get worried that we aren't getting paid properly. And so Kermit Newcomer, when he was president, appointed myself and Chris Bourne to co-chair a committee to look into that. And it was fascinating just how fairly people were paid and how many variables had to go into that, because no two people's practice at this clinic is exactly the same. And I'll take one outside the field of psychiatry. In cardiology, there are people that stick tubes in people and do heart casts, and they can make a lot of money for the clinic. And then there are people that treat your high blood pressure with medicines, and they don't make as much money for the clinic. But the two groups are working just as hard, and they ought to be paid, in part not just because of what they're bringing into the clinic, but what they're contributing. Because the guys that are just giving out medications could be putting tubes into people. And so when we looked at this, we had to take that into account, and then we had to take into account what people's contribution was to the growth and well-being of Gunderson Lutheran. That people that did a lot in the education and research fields would not make as much in the way of bringing in money from the clinical practice, but maybe did more to help the clinic out. And the benefits committee was, it was just very interesting, because, I had no training in that to start with, and we were kind of looking at how well all of us who retired from here were going to do in our retirement.
Was the study that you did on behalf of Dr. Newcomer, was that well received?
It was, I think the board did a very good job when we presented it to them, and it was, I think it kind of helped people to understand why people were getting paid what they were being paid.
And for 17 years, you provided clinical oversight of all the Department of Behavioral Health, medical, and associate staff. How big of a job was that?
It was a tremendous job. I mean, that was, I was department chairman for half my career here in two different segments, I guess, or periods. And anytime something bad happened, it was my responsibility to fix it if I could. And as the department grew, and after the merger of the hospital and the clinic, and we increased the number of therapists dramatically, it became much more of a responsibility. You know, when it was all psychologists and psychiatrists and a couple of social workers, it wasn't that hard. But when we merged with the hospital, there was something like 30 therapists that now had to be supervised and make sure that they were following the medical model, because we were a medical clinic.
You were also active with Mayo and UW-Madison students.
Yeah, I taught in the Mayo Medical School for a year. And then when I came, the first teaching that I did here was the PA students from UWL. And that may have been the most satisfying group to teach, because they were really eager to learn, and this was a really great opportunity for them to be part of that program. And most of the years they were ranked in the top 3 in the country as far as programs. And then we would have students from Madison or other medical schools in the area that would rotate through and do a rotation in psychiatry, and I did a lot of the teaching. It was kind of more mentorship, or not mentorship, but apprenticeship kind of teaching. And finally, the University of Wisconsin developed a rural medical program, and we started with 8 students, and I think it's up to 12 or 10 now. And that was their whole clinical rotation in psychiatry. So that was kind of, we're sort of the foster parents for the university, I guess, for them. And that was just basically teaching medical school. And because we were short of psychiatry staff at the time, and when you're short of anything here, the department chairman ends up doing the job. It's an interesting phenomenon. I did a lot of the coordinating of that for the 2 years that it was in effect while I was still here.
Are there actually PAs in psychiatry?
No, or there weren't at the time.
Okay.
It seems that the state of Wisconsin has a rule that you have to work for 3,000 hours and not be able to bill anything but private pay during that period of time. So it's an extended sort of program. And if we hired a PA right out of school, that would apply to them, where if we hired a nurse practitioner, that they didn't fit into that. So when I was working here, we had nurse practitioners. Essentially, they were doing just about the same job that a PA would have done.
And current now, has that evolved where, or is it the conditions or the regulations stayed the same, that it's more likely that a nurse practitioner than a PA would be hired?
I think that we have more. I don't know for sure if we have any PAs, but we have several nurse practitioners.
What typically are their roles?
Well, a nurse practitioner can pretty much function independently, under the supervision, and it's a fairly loose supervision of a physician. They get, essentially by law, they get the same level of supervision that any physician would have required in the department.
But and in terms of what they would do to assist you in psychiatry, what would their main functions be?
Well, essentially, they would be referred patients that tended to have less complex medication needs. And, you know, most of the master's degree, the associate staff were therapists. And they needed, at the time, and this has been relaxed a little bit, routine supervision by a physician. But the state has, in the last couple of years, relaxed that requirement a little bit. But the nurse practitioners, the therapists, and the PAs are all essentially independent, therapists or providers.
Is that state controlled? It differs from state to state?
Yes.
Yeah. Nationally, you were very active with the American Academy of Child and Adolescent Psychiatrists. Tell us about that involvement.
Well, I, when I was a resident, I joined the organization and then continued with it, and ended up being chairman of the private practice committee, which was a very interesting committee because I did it for 6 years, and I was just surprised at how people would call me up and ask me how to handle a situation, and they may have been half a continent away. At the time, child psychiatry was sort of struggling with its identity, and general psychiatrists, usually referred to as adult psychiatrists, always felt that they should be about 6 inches higher than we were. And the Academy actually came to a very interesting solution to that. We started voting as a block in the elections for the officers of the American Psychiatric Association. And after we took over the leadership of it, that changed a little bit. It was kind of subversive, I guess, but I was probably more active in the state level in the Wisconsin Council of Child Psychiatry.
How many members did they have?
They probably had there's probably about 40 child psychiatrists
In the state?
in the state at the time. At a time when 5 of them were at this clinic, and 1 was across town at St. Francis. So this area had per capita more child psychiatrists than most of the state of Wisconsin had.
And you all kept busy?
Oh yes. It usually take at least a month to get in unless it was a real emergency, and then you would see them right away.
Did many come through the emergency room, or was that not the usual?
Well, in child and adolescent psychiatry, we didn't admit that many kids through the emergency room. We admit some. In general psychiatry, and I would take call in general psychiatry, most of the admissions came through the emergency room. They usually after 10 o'clock at night.
What do you consider your proudest achievement?
Well, there were a couple of people that I think I was able to help enough so that they were able to reach their full potential and are doing very well.
In what recognition or awards have meant a lot to you in your career?
I think the recognition that's meant a lot are sort of thank you notes from people. I remember when I was retiring, one of my patients who had started seeing at 16 and she was now in her 30s said, you know, you're the one person that's been more involved in helping me in my life than anybody else. That was kind of bittersweet because I knew I was retiring and it was going to be a hole in her life. But so I think that probably was the most rewarding part, was the things people said to me. And you know, it's kind of gratifying to be out at Woodman's grocery shopping and have somebody come up and, do you remember me?
Do you?
I usually remember the person, but not necessarily the name. The most surprising episode of that is my wife and I, who was also a therapist here, were shopping up in Nordstrom's in Minneapolis, or at the Mall of America, and this young woman comes up and says, do you remember me? And she was working at Nordstrom's at the time. It was like, that was 10 years previously that we had worked with her. Doing well.
That's great.
Yeah.
Probably had instances of where it didn't work out as well for others.
Yeah, 2 of my patients became lawyers.
That's great.
Well,
Or not.
just depends which side of the
That's right.
medicine.
And you were also involved in outreach efforts, as you said, Prairie du Chien, but also Eau Claire, Sparta, and Toma. And then I have Cholita down here as well. Did you enjoy the outreach efforts?
I enjoyed the one at Eau Claire the most, at the Middleford Clinic. And there was, at one point in the history of the 2 clinics, that there was contemplation of a merger between Milford and Gunderson, since there were the close family ties. And I was housed in the pediatric department rather than a psychiatry department. And I really kind of enjoyed the contact on a, you know, when I was up there with the pediatricians. And because they did not have a child psychiatrist in Eau Claire, I, you know, got a lot of referrals from them that were pretty interesting people.
For many years, you also, as we talked about, instructed medical students and residents. How did the Gunderson Health System medical education and research, which was strong here, affect your practice?
Well, I really, you know, for a long time, Gunderson had a pediatric internship or residency. And so I would do a psychiatry portion of that. And one of my greater achievements was a resident named John Huxell, who was a pediatric resident here, and I convinced that he wanted to become a child psychiatrist, and he became chief of child psychiatry at the Mayo Clinic. So that was kind of my biggest teaching coup. But, you know, teaching kind of keeps you on your feet and, you know, on your toes, so that you're not getting stale, because you always have to be proving yourself to the students.
And you learn from them as well.
Yes.
Thinking back to your tenure at Gunderson, what would your colleagues say that you were known for?
I don't really know.
What would you like to be known for?
Well, I would like to be known for somebody that did my my practice well and helped my patients. I guess one of my colleagues, when he retired, sent a patient to me and said, "This person needs a real psychiatrist," and that was a pretty big honor.
Do you have any other favorite stories about Gunderson? Best day, worst day, challenge, patient who changed you?
Well, anytime you lost a patient, that changed you. And fortunately, it didn't happen very much. And so that was always pretty hard. And I have to admit that for a long time after I retired, I had dreams about Gunderson Lutheran and difficult cases that I was struggling with. I guess a mild form of post-traumatic stress disorder.
It must be hard to not personalize it, or
Yeah, it is. I mean, you hear tragic stories all day long, and it does start to weigh on you.
if you could change one thing in your years of practice at Gunderson, what would that be?
I don't think I'd want to change a lot. Probably would have taken all my vacations. And maybe spent less time being chair.
Yeah, I think you used the word enormous when you talked about the amount of time that you took or spent with it. Anything else that you'd like to share that I haven't covered?
I think you've covered it very, very well.
This is your interview.
No, I think you've done very well.
Well, we sure appreciate you coming in. And Jay sometimes has got no questions. We'll burn a DVD and I'll send it to you so that you have the interview.
Thank you.
And thanks again. It was good to see you.
Yeah. Off tape.